Okay, very good afternoon. We are on live right now.
Okay. Good afternoon.
Yes.
Hello to everybody. Welcome to our live session. We have been waiting for this for the whole week. We've just been
Okay.
going back and forth about questions and all this about the modern woman concerns and all that. Thank you very much for joining us. My name is Irene Ogongo, and I am the group admin for Patients Voice Kenya. I am also your very able assistant from the Patient Support Services Africa. And my role is really to help you to make better choices in the healthcare system and, so that it can give you peace of mind and you get the best care that's possible. With me today, I am very happy to present to you Dr. Mehta. Dr. Mehta is gynae laparoscopic surgeon and also a fertility preservation specialist. And he's here to just walk us through what's ending to me. Welcome, Dr.
Yes. Yes. Very. Thank you very much for the greetings.
All right. So today we want to discuss three things that have been a big concern, huge concern for most women in Kenya, and I'm sure in Africa as well. We have a lot of concerns around fibroids,
Yes.
endometriosis, and polycystic ovarian disease or syndrome.
Yes, absolutely.
And, we have all these questions that have been burning that we want to ask you. So I'm just going to go straight ahead and start asking the questions.
Please,
okay?
go ahead.
All right. Let's start with the most common one. Well, I think they're all common, but let's start with fibroids.
Okay.
What are fibroids? And, what are the symptoms that we should be looking out for when we have them?
Okay. See, the fibroids are the benign, that is a non-cancerous growth of the muscles of the womb. That, as you can see, this is the diagrammatic representation of the, this is the uterus and both sides are the ovaries. So fibroid usually develops in the muscle layer of the uterus, that is the womb. Okay. These are very common things. It's not at all a cancerous thing. It mostly occurs in the reproductive age woman. And like if I examine around 10 women, I would find fibroids in around 2 to 3 women. But it doesn't lead, yes, but it doesn't necessarily need to cause any problem to the woman. Like it may vary from very small size of a pea size, and sometimes it may grow as large as a melon size. Okay. But most of the fibroids are asymptomatic, means they don't cause any problem to the woman. But sometimes they increase in size and give rise to a lot of complaints to the woman.
Yeah. So one of the common complaints that we have as women is the bleeding that comes with it.
Yes.
And it causes a lot of discomfort. You can't quite go out there, with confidence because you don't know when you're going to bleed out.
Yes,
and that is normally the biggest pain point. And so the question is, how are these things managed? Is there a stage you reach and say, okay, if it's the size of an orange, then you can remove it, or what are the options that we have for treatment?
Okay, so first and foremost, as you said, that it affects the day-to-day life of a woman being. Okay, so if they are causing you a lot of problem, I advise you to go to the gynecologist and we do a simple sonography. Okay. Sonography, we tend to find out, number one, the size of the fibroid. Number two, the location of the fibroid, where it is actually located inside the uterus. Number three, the numbers, how many the fibroids are. Okay. So if it causes, as you said, if it is causing you a lot of problem, then we may start off with some medications. Like this medication decreases the flow of the bleeding, improves the quality of life, like it gives you the pain-free intervals. But these fibroids are the solid tumors. There are not any medications which dissolves or diminishes the size of the fibroid. In a way, you need to remove this fibroid surgically. Then only, like, it is the perfect cure of the fibroid. Like, as long as you take the medicine, you will be fine. Once you stop the medicine, again it will haunt you with a lot of bleeding and all the complaints.
Okay, so I have two questions for you. This is actually interesting. So one, you said something about location. So the location of the fibroid actually determines whether it's going to be problematic or not.
Yeah.
Okay.
Yeah.
And then number two, you said something about there's no medication that you'll be given that will shrink it.
Yes,
now,
right.
Here in Africa, I can tell you there's a lot of myths around it. And there's a lot of over-the-counter medication and concoctions that are being sold to women as,
cure of the fibroid
solutions. Yes,
okay.
As solutions that are going to shrink them and make them disappear. And then, as you said, you take the medication and then when you stop, they come back. So it's actually interesting to hear you say that, there is no medication that will shrink it. It can only help you to manage the symptoms.
Like sometimes, like if the fibroids are very small, okay, like 1 or 2 centimeters or so, so then we tend to give some hormonal tablets, or we can put some hormonal intrauterine device, like as you might have heard about the Mirena. Okay. So they tend to decrease a little bit of size, but again, once you stop those tablets, again the fibroids may reappear. Okay. And so in some cases it may have the effect, but very rarely. Second, there are some new generation medicines are coming up, which are claiming that they diminishes the size of the fibroid, but one, they are very costly, and second, you have to take those medications for a longer duration of time, like 6 months, 9 months, and again they are not as much effective as we tend to find it.
So the other question that I got was that, so most of the time when you visit the gynecologist, that you'll be given two options. One, to remove the fibroids, or two, to remove the uterus if you're done having babies and all that. So the question that was sent is which of the two is a good option, and what are the pros and cons of either of them?
Okay, so definitely the decision of removing the fibroid only or the whole uterus depends, number one, on the patient's desire for pregnancy or not. Like if she is 45 something around, and she has completed her family, plus if she is having multiple fibroids, she is not having a single fibroid, then it is better to remove the whole uterus only. Because if she is having multiple, like 4-5 numbers of fibroids, then she is having more chances of developing the fibroid again once the surgery is done. So in those cases it is better to remove the whole uterus. But in the cases like the young girls, 25-30 years of girls who is yet to start their family, right? So in that cases, we don't need to remove the whole uterus. We can simply remove the fibroid only. We do it with the laparoscopic way. It's a minimal invasive surgery. We just remove the fibroid only and suture and reform the uterus. So in the future, that lady doesn't have any problem regarding the pregnancy.
Okay. Last question about fibroids, and then we can move on to the other concerns. So the first question is it inherited? Because that's something someone asked. Is it likely if my mother had it or my grandmother that I will have it? Is it hormonal? Because if it is it the one that is causing us to have issues with our weight? And, if that's the case, what can we do about it?
Okay, see, the exact cause of the fibroid is still unclear. Like, how does it develop? There are different theories which are circulating around. Most commonly, the hormones, like which determines the level of our function of our whole body. The main basic hormones for the woman are the estrogen and the progesterone. They tend to grow the fibroids. Okay. And the fibroid is mostly occurs in the reproductive age groups, meaning around 15 to 45 years of age group. So once the woman reaches the menopause, usually fibroid, at that time the hormone level decreases, and then usually fibroid doesn't grow up. Okay, so fibroid does have the hormonal link with it. One more thing is it is also having a genetic and familiar tendency also. Like if your mother is having fibroid, there are chances that you might get it. But as I told you, it's a very benign and non-cancerous thing. You doesn't need to be worried about any cancer or anything like that. But yes, if the fibroid is bigger in size, it may give you so many period problems and like that.
Okay, great. So I'm sure we've had all this, very good answers about fibroids. And I know that if we have any follow-up questions, we'll be able to contact you.
Surely,
so now
surely.
let's talk about polycystic ovarian syndrome or disease. This is the big skeleton in the closet because nobody really understands it. We talk about it and, you're casually told you're suffering from it, but we don't really know much about it. So kindly tell us, what is it, what causes it, and all that, and the symptoms.
Yes, I do understand. The PCOD term is, it's very frequently and very loosely used. Like women tend to say that I am having PCODs and like that. So actually, PCOD means polycystic ovarian disorder, right?
Disorder, okay.
Okay. Now again, this is a very common this hormonal disorder. This is again a hormonal disorder, affects more of a reproductive age group woman. Usually it occurs in the younger age group, like teenage girls and more of the girls who are in their 20s or so. So before we understand what is the PCOD, let me just briefly tell you about the normal cycle. Okay. Again, you see this diagram. So these are the ovaries and this is the uterus. Okay. In the ovaries, the eggs are developing. Okay. In each cycle, the job of the ovary is to develop one good egg. Okay. So slowly, gradually, these eggs develops. It releases around 14 to 16 days of a period. And if the girl is not pregnant in that cycle, the woman would have periods on around 28 to 30 days. So all this is happening under the normal influence of the hormones. And this normal healthy woman would have cycle of around 28 to 30 days. But what happens in PCOD, that the hormone levels are disturbed. Okay. So the eggs are not properly formed inside the ovary. Rather than that, there are multiple underdeveloped small eggs. Okay. So the ovary is enlarged in size and it will look as a clumps of grapes when I do the sonography of the such patient.
Okay.
So usually what are the symptoms of this PCOD is like the woman would have irregular cycles, like she would be bleeding every 3 months or 4 months like that. And at that time also she would be having very heavy bleeding. As I told you, there would be hormonal disturbance. So in such girls, there would be increased amount of the male hormone, that is androgens. So she would be having oily skin, acne, pimples, facial hair growth will be there. Then there will be disturbance of the metabolism. So it is called the insulin resistance. So these girls would again have more of obesity and like this. Basically, all these are because of the disturbed irregular life cycle of today's modern lifestyle. Like you can see, we have more of a junk food, fast food consumption. More of the young age people would have disturbed sleep wake cycle, like they tend to sleep late at night. There is lack of physical activity, exercise, which increases the obesity. So all this tends to add up and disturb your hormonal level, right? And because of that you develop the PCOD and you have all these consequences with you.
So one of the ways that we can manage PCOD is really just trying to get back to, a healthy lifestyle and
Exactly.
all
exactly. One, and that is the best way to do so. You will be surprised that if you control and modify your lifestyle, 70 to 80% of cases will not have any kind of problem with the PCOD, right?
Wow.
So the first and foremost is to control your weight. Like you need to have a certain weight only according to your height. Okay, roughly I would say if you decrease your weight, 10% of your weight you decrease, you would be fine. Your hormone level will be doing fine with your body. You will have no other effects of the PCOD. Like suppose if a girl is weighing around 70 kg, so if the reduces of her weight of around 5 to 7 kg, she will do good. Avoid junk
Wow.
food, avoid junk food, avoid fast food, eat more of the fresh fruits, fresh juices, dry fruits. You know, all these food items have a very good antioxidants which normalizes your hormone level. Do more of exercise like
Yeah.
swimming, yoga, zumba dancing. In a way, I want like if you have the PCOD problem, you need to modify your life completely. Then I don't think you need to
Ah,
take even any other medications also.
okay. So basically, I know most people visit, the gynecologists and they get diagnosed with this, but they keep carrying medication home that doesn't, it's neither here nor there, because you then have to keep managing symptoms and not really treating the disease. So basically, the disorder can only be treated effectively with us, completely overhauling our lifestyle and, getting back to the healthy way.
Exactly. As you
Great.
can
So
observe
that's
that
one, I mean, it's, mm-hmm.
yeah, as you can observe that PCOD is manifestation of today's generation, today's lifestyle. Back then, before 20-25 years, we didn't were hearing this much about the PCOD because at that time we used to have a more healthier lifestyle.
Yes, I agree
So
that, the fast food industry is really our breaking
yes,
point, especially for women. We have a sweet tooth. We want to
yes,
have cake and ice cream and, all
exactly.
these ordering kind of foods.
So
So yeah,
I
I mean,
also don't
it's
say
I can imagine, sorry, I can imagine for, the regular woman, I have to go to work, I leave the house at 6, I have to come back at 9 in the night. I don't really have time to cook because I'm tired. So the best thing is to just carry fast food and eat. It's not that we do it consciously half the
yeah, but
time. It's become
it is
so
an easier way
unconscious
to do.
that we
I
just do it.
understand.
Yeah.
Yeah,
Mm-hmm.
I understand that it's an easier option and we tend to go ahead with that thing. But so I also don't say stop your fast food at all, but just
Yeah.
try to use your fast food level. Like if you are eating 3 times in a week, try to curtail it by 1 or 2 times. Okay, that
Yes.
will help your whole body system to be in the proper balance.
Yeah, definitely. I agree. Having been, so what you probably don't know about me, okay, right now I am nursing a shoulder injury, but on a regular basis, I try to work out. I used to be really, really big, and then I had to change my lifestyle and all that. All those people who know me know that side of me. And I can tell you it's a lot of work. It's really about the mindset because nobody can do it for you, but it
Right.
helps to have someone to walk the journey with you in terms of making the choices and deciding to work out and all that. So I would say, as advice from me who has been there, find a support system. Find a support system, people who are moving towards the same direction. It's easier
Yes,
for
yes.
you. Yeah. Okay, so now let's talk about endometriosis.
Okay. Hmm.
Yeah, tell
Again,
us.
again, it's a very common gynecological disorder, but
Yes.
it is a long time disorder, and it usually affects the woman in their 30s and 40s. Okay,
Okay.
so briefly, I'll again tell you the medical pathway of that. See
Mm-hmm.
what happens during the period time that
Mm-hmm.
the inner lining of the womb, along with
Mm-hmm.
some tissue, comes out of
Mm-hmm.
your body, and
Mm-hmm.
we call it as a normal bleeding. Okay,
Okay.
normal menstrual period. But in same
Okay.
case, what happens that this tissue, instead of coming out, goes in a reverse direction. So this
Um,
this tissue and the inner lining of the womb passes through the uterus tubes and gets deposited onto the ovary, onto the outer surface of the uterus and everything like that. So this becomes the implants on all this outer surface. And every time when the woman is bleeding, these all spots also bleeds. Now you understand, this bleeding
Yes.
doesn't have any access to go out. So the woman was having very severe excruciating pain during the period time. Like this pain starts before the period. During the period time, she needs to take some means painkiller tablets, or even she needs to take some injections also. Her daily routine life is disturbed because of this severe pain. Sometimes the woman may have, the pain during passing motion, or pain passing during the urination also. So her whole life is pretty much disturbed because of this endometriosis.
Wow. This one is very, I would want to imagine that it weighs down on someone psychologically as well.
Yes.
And handling after going through my shoulder pain for, I don't know, 8 weeks, I can almost, be able to tell what it feels like to live with pain every day. It may not be the same kind of pain, but pain is pain regardless. And it's difficult to work around it and be sane and be productive and interact with people.
Exactly. And this kind of pain, we consider it's one of the worst kind of pain. It really hampers day-to-day life of a woman. And as you rightly said, that woman is managing so many things together. So to manage all things with the pain, not only she is physically exhausted, but psychologically also she is not in a good frame of mind.
No, at all. So what is the treatment? Is there a treatment for it? And I hear also that women who are suffering from endometriosis have a very difficult time conceiving.
Yes.
What happens? Is there a remedy?
Yes. See what happens usually, as I showed you, that these endometriotic implants are form a hostile environment for the eggs and the sperms. So yes, these women do have very difficult time in getting pregnancy. First of all, when any patients have this complaint like this, we usually advise her to get properly examined. We do the basic ultrasound and we get to know how much is the what is the grade of the disease, mild, moderate, or severe. Okay, if she is having the mild type of the disease, then we can give some hormonal tablets. Now we do have some wonderful injections also with us, which decreases the this all the implants and everything. But if she is having the moderate or severe kind of endometriosis, then she needs to undergo the laparoscopy. Actually, laparoscopy is the gold standard for the diagnosis and management of such kind of patients. So we tend to do usually this the girls who are in the reproductive age, like those who are desirous for the pregnancy, may tend to have some chocolate cyst. Chocolate cyst is like the deposition of the endometriotic tissue over the ovary. So in this case, with the laparoscopy, we just remove that chocolate cyst kind of thing. Other ovaries we preserve and ask those girls to get pregnant as early as possible, because pregnancy is kind of remedy to this problem. During the pregnancy, there will be release of certain hormones which decreases the severity of the endometriosis.
So is it right to say that if you have it, and you're not pregnant and you go for the treatment, it can reoccur?
Yes. It is very
So is it something that you'd have to live with for the rest of your life, even after you have kids?
Usually after pregnancy, it decreases in its intensity.
Right?
Okay, so it usually occurs more in the women who don't have pregnancy, because of the because during the pregnancy time, it increases some of the hormones which reduces the incidence of this, and it may remain permanently like this if after the once the woman is pregnant. So again, this is a hormonal disturbance. So once the number one is the pregnancy is a good thing for the endometriosis, and second, if the woman enters into the menopause, at that time she is not having the hormones, then again that time also she would not be having much of a complaint as regard to the endometriosis.
Ah, okay. Wow, that's a lot of information, very good information. I am learning a lot of things that I didn't know. And, I am a nurse. It's difficult. Sometimes it's hard to find someone to explain the way you've done it. Now it's easy to understand. So the question is it inherited or is it just occurs on its own? Is there a tendency?
Again, it may run in the families.
It may run in the families.
Yes, it may run in the family. It may have some genetic predisposition.
Okay. Wow. That was very helpful. And I know that I've tried to ask as many questions as I should have in the 30-minute session that we had planned for. But I would want to, ask you in case we have follow-up questions, someone who wants, more clarification, is there a way that we can reach out?
Yes, definitely. You can reach out to my email ID, and I'm also available and doing the teleconsultation. So
teleconsultation.
Yes, we can, discuss as we are discussing right now, so that I can be more precise about a particular patient. I can go through her reports. Actually, right now also I'm doing so many teleconsultations from your side also. Okay.
Ah, good. All right. So guys, ladies, as you've heard, I'm sure there are some guys who are also watching. If you feel like, I can use a second opinion. Second opinions never hurt anybody. If you have your reports, your records and all that, kindly contact us and we will be able to link you through to Zydushospitals and Dr. Mehta. Oh, Dr. Mehta, before we go, I have a question for you. This is just purely out of curiosity. It wasn't part of this, but let me ask.
Yes, please.
The other part of your title is Fertility Preservation Specialist.
Yes, right. Yes, right.
Yes. So, and I know that even though nobody asked me, many women are concerned about, we have them, people who are trying to conceive and, having difficulties and, there's all these other modalities that are being brought forward, IVF and all this. And then I hear your title and I'm like, interesting. So can you tell us just a bit about that?
I'm glad that you asked me. Okay. See, as we mentioned, all this disorder like the PCOS, fibroid, endometriosis, those all are affecting mostly the 20, 30, 40 years old woman. So all these women are also trying for the pregnancy also. And all these three things may come in their way to get the pregnancy. Okay. So what we are trying to do is so in a way, there is some disturbance in this whole system, right? And because of this disturbance, that lady is not able to get pregnant. So what we are trying to do, we try to remove the problem and make the system as natural as possible. We can do that with the help of the laparoscopy or the minimal invasive surgery. Okay. So we are not going for any IVF or any other treatment. We are trying to make the uterus, tubes and ovaries as natural as possible. The concept behind that is that as you remain as close to the nature as you can, the nature will help you to get the pregnancy. And we have seen that after doing this laparoscopy and restoring the fertility of a woman, around 70% of the woman gets pregnancy naturally only.
Oh wow, 70%. That's a big percentage. Thank you for that. I said I have to ask this one because I have not seen anyone by that title around here. And I know for a fact, and I know even some of my friends are really trying to conceive, and this kind of information is good for everybody to know that there's another way. It's not only the IVF way or the other ways. Yeah. So again, ladies and gentlemen who are watching, if someone who would, benefit from this live session, please tag them, and we are going to post a video, a replay of it. It will be on the page Patient Support Services Africa. It will be on the Zydushospitals page, and and I also put it in the group, the Patient's Voice Kenya. And reach out to me. Let me help you connect to this very resourceful team, and so you can have peace of mind and you can have the best care possible out there, because it is possible to have the best care with the least frustration. That's what I'm trying to do for you. All right.
Exactly.
Yes,
I just want to mention that point only. Right now, the medical field has tremendous advancement and everything. And all these problems can be solved with proper treatment, with proper medications or proper surgery. So why to live with all this suffering, right?
Yeah.
It is your fundamental right to live healthily. And we are here to help you out for that.
All right. You had him.
Yeah.
They are here to help. I am here to connect you to them. What's stopping you? Second opinions are a way to go. If you feel like you can use a second opinion, contact me. Let's talk and see how we can connect you to the right people. Thank you very much, Dr. Meta. In Kenya, we say, or in Swahili, we say Asante sana. That means thank you very much.
Okay.
And, we shall be connecting very soon via teleconsultation, because I'm sure we'll have a few people, who want to, speak to you.
I understand.
For the guys who are watching, he spoke a lot about pain, and, and I'm sitting here thinking, and I can tell you for free, I know you're smiling. Yes, we pop painkillers like it's peanuts or groundnuts. And that is also coming with other side effects.
Definitely.
So maybe next week, let's see how we can talk about pain, painkillers, how to manage pain, and what are the effects of all this paracetamol that we take all the time.
Sure.
It's masking our pain. It's helping us to move from this hour to that hour before we take it again. Next week, we'll be talking about pain medication and how we can be able to manage pain with the least side effects. All right. Thank you very much.
Thank you very much.
And,
it was wonderful.
Thank you.
With you.
Yes,
thank you.
It was. All right. Till next time.